Hello, I'm Dr. Lance Morris, and welcome to my weekly YouTube posting. This is number 38 of a sequential series. In naturopathic medicine, there's a principle. The whole is greater than the sum of the parts. We are confident that we know all the ingredients that make up life. Many scientists have combined these ingredients in a test tube and added an electric spark. These experiments have never been successful in creating life, but definitely making soup. What might happen in these same experiments if we could actually add qi and not merely electricity? The first drugs produced were concentrated herbal extracts. We then discovered how to isolate and concentrate specific biochemical plant components. We then further developed ways to synthetically manufacture these constituents, and then we discovered how to make completely novel synthetic analogs of these components. Now we've entered the realm of modern pharmacology. Digitalis purpura, or foxglove, as it is commonly known, is one of the early plants to undergo this concentrating process. Digitalis is a natural cardioactive glycoside. This is an herb that both protects and strengthens the heart. In naturopathic medicine, we virtually never use it. The reason is that it is a very potent emetic. It causes severe vomiting in relatively small doses. This emetic property is induced by toxic alkaloids in the plant. In the whole plant form, the toxic properties are more dangerous than its healthy properties. In the whole plant form, digitalis is warning us to preferentially not use it. As naturopathic physicians, we're taught to avoid many herbs in favor of more effective and safer herbs. In this context, one example, Convallaria majalis, or lily of the valley, is actually a much more potent cardioactive glycoside with much less toxicity. Despite this fact, it is still important to use herbs like Convallaria under the guidance of a properly trained physician. In modern pharmacology, one of the first heart drugs developed was digoxin, derived as an isolate from the digitalis plant in the 1930s. The difference between a therapeutic dose and a lethal dose of digoxin is relatively small. For this reason, blood levels of digoxin have to be frequently monitored. Today, even this drug is rarely used in deference to other drugs. In my clinic, when I was using RST, it was awkward for me to be walking around either barefoot or in socks. As a medical facility, this was definitely not approved. Then the solution popped into my head. Get moccasins. Indigenous people had the answer. Of course, they knew the importance of maintaining our energetic connection with the earth. So I went out and purchased a pair of moccasins. I remember the day I proudly entered my office with my new moccasins and announced to my patients and staff that I had a functional solution to my barefoot problem. I was really excited to engage my first patient doing RST with my new moccasins on. I placed my hands on the patient and started vocal toning. Oh no, wait, the same heat and pressure went immediately to my feet, and I had to kick the moccasins off. I was confused and frustrated. I did not understand. I felt confident that the answer I was seeking would be resolved with moccasins. The clear and uncontestable evidence was to the contrary. Let me emphasize at this point the importance of being guided by our direct subjective experience as an overriding principle rather than our intellect or theoretical conjecture. For clarity, of course, we can use our brains to their fullest capacity. We just need to be careful in assuming the accuracy of mental process or allowing too much authority from mind-driven outcomes independent of subjective experience. At the end of my disappointing first attempt to use moccasins for my patients, a voice in my head said, "Just wear them." I wanted to argue. I knew they didn't work, but I decided to let it go. I wasn't trying to use the moccasins for patient therapy, but I was wearing them as daily footwear. Tune in next week to discover my startling awakening realization about moccasins. Enjoy. Please remember to subscribe, like, and share.